San Juan Regional Medical Center, talking about medical records, health information technology. Scarlett Denman is here, and she is the Director of Health Information Management at the hospital. Good morning, and thank you for coming in.
Thank you.
Great to have you here. Tiffany Kerschion is also here with us this morning, and Tiffany, you are the Supervisor for Health Information Management at San Juan Regional.
I am.
Good morning to you.
Good morning.
Thank you both for coming in. And so talk with me a little bit about, and Scarlett, let me start with you, about this idea of medical records, electronic medical records, and it's certainly maybe much more than maybe it used to be just a few years ago, right?
Absolutely. I mean, I go back, I've done this 38 years, and it was paper,
Right.
all paper. A lot of people think when we went to an electronic medical record or electronic health record that, oh, we're getting rid of paper. We'll never be paperless. We will be paperless.
Right.
You know, and which has enabled patients to be able to see their portals, be able to get their records electronic. Our providers sign electronic. Used to, they had to come in the department and sign paper.
Right.
And there's a few things still that need to be papered, and we get those scanned in, but other than that, it is electronic.
Sure.
And the management of that.
Right, and with anything new and different, I imagine there's been a learning curve for folks maybe in your department and also with your providers and things like that to learn maybe how to interface and interact with these new ways of storing patients' information?
Correct. You know, we have some of our old-timer or older physicians are like, nope, I don't want to dictate, I want to handwrite. You know, the staff actually adapted very well.
Mm-hmm.
You know, I have been in places, I've done electronic records, my 4th EMR to go with, and I've had staff literally retire because they're like, nope, not doing that.
I'm out.
Yeah.
Okay.
But, you know, a lot of our team did do very well.
Sure.
You know, because they went on a new EMR 5 years ago.
An EMR, electronic medical
Electronic
records.
medical records.
Just
Yep,
making
all
sure
the
everyone knows.
acronyms
That's
we
okay.
gotta
That's
use.
right. That's right.
Exactly.
Okay, and I imagine maybe it's not just the providers, but maybe the staff too, right? Because maybe if you had a provider that wants to keep dictating, the staff needs to be able to transcribe that, I guess, and put it into the medical record format? Is that kind of how it would
Correct.
need to work in a transitionary period?
Exactly. We used to have a lot of transcriptionists who would do that and transcribing. We actually have one in our department, and mostly she does the radiology and imaging stuff, but also some of those providers that still want to dictate old school or something, and she's transcribing those, and then they will sign electronically.
Got you. Is some of the technology helping with that, I guess? Because it seems like, I mean, I can do a text-to-speech or speech-to-text message through my phone. Is that becoming more reliable to be able to do that?
And as we heard about the electronic and voice and Dragon for many years, it has progressively gotten much better. And so the provider is still responsible for checking what is on their screen. Some are good about it.
Yeah.
Some are others. There's jokes out there with terminology and what it ends up transcribing into.
Right, sure. But there's some checks and balances.
Yes, there are.
For sure. Before
Absolutely.
it gets into the permanent record, I guess,
Yes.
right?
And then if it doesn't, the patient can request to amend that.
Good point. Very good point. And so that's kind of where we are, I guess, today with this whole process. And as you said, it makes it a lot more accessible, it seems to me, for patients and providers, right? I mean, I can be sitting at home and I can call up my medical record and see what's in there about me if I wanted to.
Correct.
Right? Or
Correct.
whatever's going on, correct?
Because they can get their records, they can see their appointments, their results. The only thing today that you can't is actual the image of an MRI or a CAT scan.
Right.
There are ways around that, you know,
Okay.
that are being developed, but that is the one last piece of technology being really worked on heavily. Because a lot of times they're like, oh, I have the report, I want to see the picture, you know.
And is that, you think that's the next step? You think we'll be seeing that pretty quickly?
Yes.
Coming?
I do.
Gotcha.
We're already, we have ways to do it, it's just still a little clunky and not smooth, but that's getting perfected.
Right. And the issue being, I guess, is just because it's different pieces of software or different things that have to talk to each other and
It
work
is, it's
together and
different.
integrate.
Plus, it's a lot of storage, you know,
Yeah.
for an image.
Sure.
You know, over a transcribed document.
Okay. Gotcha. I want to see all the slices of my MRI. Right?
Exactly.
That's a lot. That's a big
It
file.
is a lot.
So there you go. Very good. Tiffany, I want to ask you a little bit about the job that you do, of course, supervising this whole area. And so talk to me a bit about that. What does that entail?
I started a few years ago as just the release of information supervisor, so just the medical records. I have moved up a little bit where I now supervise the health information management department as a whole. It's a lot of learning for me. There's little areas that I'm still kind of getting into. Coding is very much my weakness. I have enough information to be dangerous, but nothing to really help anything.
I don't know if that's true.
I can promise.
Okay.
But my passion and my love really lies with release of information, and that's where I'm most knowledgeable in
Right.
that area.
And so that's dealing with patients then, to release the information to them?
So it's the release of their medical records.
Sure.
So anything that involves the releasing of the patient's medical record. And that's really the last point of the health information management. Because when you get into it, there's the patient that gets seen, and then we scan it in, analyze, code, and then the release of information is really that last front before that record really goes out the door.
Got you. And the reason for that would be a patient wants to go to a different provider, or they're asking for a second opinion, or is that some of the reasons they
There's
would come
so
to you?
many reasons
Okay.
why you can have a release of information for medical records. Sure, a patient is going to a new provider. They're moving to a different state. They want to take their medical records with them. Sometimes they just want it, to hold it.
Sure.
And then there's also
Or for the children, I suppose, too, right? This is another issue, right?
that, yes, for children. We also have where disability, so if you're applying for disability benefits, they would ask for those medical records to be able to verify that disability. So that's another option. There's
Okay.
many facets of release of information.
And that's what you deal with mostly.
Mostly, yes.
Got you. And so when that comes in, are these as easy as hitting send on a keyboard to send these electronic records to someone, or do you have to print these out and have them pick up a binder full of whatever they're asking for?
Short answer, yes.
All right.
It depends on how large their record set is. We have some people that come in and they say, I want all of my records that you have. That could be many, many, many years.
Right.
And so that's what we do. And at that point, we hand them a box, essentially. And then there's other times where if it is a little bit smaller and we're sending it to another facility or anything of that nature, we can just hit send on the keyboard and it will go electronically.
Got you. It just depends on the situation.
It does.
I guess. So that makes a lot of sense to me.
Yes.
Got it. And so you folks have recently moved to a new office location, correct?
Yes, we have.
And so we want to talk a little bit about that as well. Not at the hospital proper anymore, but
Mm-hmm.
still in the downtown area. And so talk to me a little bit about that, just for more space, more elbow room.
It was, and to provide where we were, we took up a large space in the hospital near the emergency room, and so now that will be converted to more clinical
I see.
space that is much needed.
Right.
And so we are now currently at 300 West Arrington, Suite 101. And just to give landmarks, we are literally right next to the Civic Center.
Right.
It's a 3-story building there.
Or folks would know the Kaiser building, that's where you are.
Exactly.
You're in that building
Yep.
right there at Arrington and Barron, basically.
Yep, and for patients to come and get their records or anything like that, it's 8 to 4:15, Monday through Friday, for us to be able to serve them.
Got it. And we put up on the screen a little QR code that folks could, I guess, point their phone at that, and it should get them to what would that show them then? A place to register for their portal? Is that it?
No, actually,
Sorry.
this is probably one of my favorite things that we've gotten in the last year. So that is actually a way to request your medical records without having to come in person.
Ah, okay.
And it is an electronic medical record that you can request from, and it is very, very easy. You hear a lot where the older generation, they're just not technological savvy. Our biggest demographic that utilizes this is 71 to 80. And with us living in such a rural community and area, this is a wonderful tool.
So they wouldn't have to literally get themselves to your office. They could do this.
Correct.
Or a family member could do this and help them access their medical records.
Correct.
Without coming to see you in person.
Yes, and
Although-
then they don't even have to come and pick them up if that's the case either. We are happy to mail records.
Ah, okay. Good to know. Very good. And the other information we wanted to share too is this patient portal, which is another QR code. Maybe that's the one I was thinking of, but this is to see these things, to see these medical records
Right.
online?
Right, because so a patient, or if they need a family member, they can sign up for the portal. If they have any hiccups or issues with it, they can call our department and we will try to guide them through. But that's where they can see their appointment, sign up, they can see their appointments. We don't ever see their login or their password. It's totally secure for them. And so that way they can get the records that they need.
Right. Got it. And-
Again, not even having to come in.
Right.
You know, and if there is somebody who's tracking a treatment or diagnosis, they can keep going in for every one of their treatments to see that information.
Got
Once
it.
the provider has finish the record.
Okay, got you. And I guess there's other things like notifications and things like that that come with these things as well to the patient, or are they logging in? They're not getting information from the record,
You're
basically.
logging in. And there's also an app that's not very well known that does go with this as well. It is the Healthy Life app, and it's actually healthy with an E at the end instead of a Y.
Okay,
And so that's in the App Store, and it's very easy to use. Same portal that you're always going to see, but now it's an app, because we all
Okay.
love apps in this day and age.
don't we? There's an app for everything, so that's true. But again, I guess it's really all about patient convenience and speed and information, and so and transparency, and so this is another way that patients can take more control of their health care and
Yes.
and for them and their families too, I guess, if they need it, correct?
Correct.
And so that's
And if they
kind of
do
the
come
idea.
in person, we do need them, it's one thing that's sort of like missed at times, is we need them to show their government ID,
Sure,
so we can validate who they are.
right, make sure it's the right person
Correct.
who's getting access to all these personal things, right? So that would be important. And so talk to me a little bit about having these things online. Of course, that opens up a whole new idea of security and safety and things like that. I imagine like any IT situation, you've got to have security and things like that at your end too.
We do. We have, there's a big world in itself about cybersecurity. In fact, we're in Cybersecurity Month.
That's right.
You know, so
I have a training I need to do today.
yeah, exactly. We have our staff all get education, learning education through the year. We also have phishing campaigns, you know, if somebody tries to trick somebody into opening something they shouldn't, all of that. Plus then, and that's one of the reasons why on Patient Portal, we never see that password, you know. We can have a reset done, but we're never gonna see that. So it protects us and it protects the patient as well.
Sure, and that's important. And talk to me a bit about patient privacy, because that's another big issue that I remember back in the old days of paper records, HIPAA and things like that. And certainly that's got to be an ongoing concern, because you never want to send somebody someone else's records or the wrong thing, or have access to the wrong thing. This is also probably built into the system that you're using.
It is. And, you know, our team is very good about, we have what's called great catches, even though, sure, we're HIM, you know, and if clinical puts it in a wrong chart or something on the floor, my team actually catches that last stopgap, you know, to check that. And we have found that before, and we correct it. Patients, unfortunately, have found it as well if it's never caught. And so we take it very serious. We take it very highly regulated between our IT department, our compliance and risk, and privacy.
Right. And that's kind of the different, again, checks and balances, I guess, that you have
Exactly.
built into that system. And again, Tiffany, this is something also that you deal with in your work as well?
Yes. My team is amazing. Earlier Scarlett had mentioned the great catches that the hospital does.
Right.
And that is whenever you report a safety event, they call it a great catch, and you get a baseball signed by all of the upper leadership of the hospital. Earlier this year, Health Information Management was leading the hospital in great catches. Just their attention to detail is bar none.
Gotcha. And yeah, and that's really important. And so congratulations
Yes.
on getting all those baseballs, and good for the hospital to recognize and reward, I guess, folks who are doing that, to make sure that they're on their
That's
toes,
wonderful.
right? And that's an important thing for patients to realize too. And so as we move forward with this idea of health information management and all these systems are coming together, and as maybe more programs become more adept at talking to each other, is that going to be a good thing, or can it be unmanageable when it gets too big?
It ends up getting, you have more people behind the scenes doing those checks and balances we talked about for the simple reason of protecting that patient information.
Right.
Because, you know, on the black market, your credit card, $3 on the black market, but your medical record is over $100.
You're talking about what the value is if someone wanted to buy my credit card number
Malicious.
information.
Yep.
It's $3. If it's medical records, it's a lot more,
It's
worth a lot more to them.
per record.
Because why?
Because of the breach potential. With your medical record, I can go and get, if I'm a bad person and have malicious intent, I can steal your identity, I can get health care, I can get drugs, etc. by that.
Got you. Because you know my name, you know my social security number, you know my insurance information, all that is what you're talking about. And that's why
Correct.
that's so valuable. So
Correct.
it opens up all that, which
This
means,
is protected health information.
right. So, got it. Okay. Now I'm worried, but I'm not, because I know you've got checks and balances, and
That's right.
everything's fine, so that's
Exactly.
But that's true, this is the world we live in, though, right?
It
And so
is,
that's,
unfortunately.
that's part of this whole thing. And so, with these things that are available, how many, and I'm gonna put you on the spot, I don't know if you know this answer or not, how many different medical records or individual records do you maintain?
Oh, we actually just had something a couple of weeks ago, and I think it
Okay.
came up approximately the whole is
Sure.
like 27 different legacy systems that IT and, senior leaders have to maintain. We are, with our new chief information officer, trying to get almost like a repository.
Right.
So that's a big goal next year that we have, is almost like one-stop shopping.
Right.
My staff have to log into numerous systems throughout the day just to do release of information. As Tiffany said, somebody had been coming to us for years. They could have been paper, they could have been on our old EMR, our new one, and oh, by the way, they were in a clinic that we purchased. So there's many different facets of that.
Gotcha.
So that's why we're trying to come up with this one-stop shopping. You go to one spot with the secure logins, for the staff, not the patients, but for the staff at that
Sure.
point.
And so I guess the process is to convert all those legacy systems or figure out a way to get them all into the newest system? Is that kind of the
Correct.
idea?
Correct.
And so how many records would you say are on all those different systems? Do you have any idea of how many that's
Hundreds
all?
of thousands.
Okay,
you
I
know.
figured it was a big, giant,
It is.
ugly number, so.
It
But
is.
I thought just for folks to realize how many different items you guys are managing.
Correct,
It's a lot.
because just because you have an EMR doesn't mean you keep that record forever. In this New Mexico, we actually have a 10-year retention period.
Okay.
So from 10 years of last date of service for that patient, unless it's age of majority, because minors, we have to keep much longer.
Sure.
So we keep those. Just because you have an EMR doesn't mean, oh, we're going to keep it forever.
Right, got you. But if someone wants a copy of that before it goes away 10 years ago,
Absolutely.
they can get that and have it,
Absolutely.
and that's their right to do.
Absolutely, it's their record.
Gotcha. And Tiffany, that's kind of what you deal with, right? Is when folks come and request those
Yes.
records, right? And so it could be 10 years old, but you can still pull it up in many cases?
In many cases, I cannot, my team can't,
Sure.
but,
Understood.
but in many cases, if we have the medical records, even if they're dated back pretty far, if we have them, we have to produce them. Just recently, when Scarlett got here earlier this year, we had what they call microfilm and microfiche.
Oh, yeah?
And that is a very old, disparate system. And we found records going back to the 70s. And we have started a destruction process on that, hopefully to kind of get that out, because if somebody comes in and they want their records from 1985 to current, and we have that, that's an entire day for one of my team members to get all of that together.
Right. Got you. And even though it's beyond the 10-year limit, they could still
We still
request
have
it,
it.
and they can still get it?
As long as we still have it, we have to produce it.
Got you.
Correct.
I see. And so microfilm and microfiche, that's a term I haven't heard in many
years.
years. But we see them in libraries and things like that. It is a term that I think maybe researchers know, but it's a way to it used to be a way before computers, I would say, to store quantities of information. And so this is something that you're still dealing with, I guess, until you get rid of it. And I'm sure there are rules about how to properly dispose of these things too, right? Once
Correct.
Once
You
their
can't
life is
just throw
over.
them away.
Not just
You
toss them in
can't
the
just-
trash.
You can't just shred them. They have to be
Incinerated.
Yeah, incinerated, pulverized.
Got it. And the reason being just so no one else could reconstitute them, I guess, or
That is accurate.
or something like
Yes.
that, because they're so sensitive.
Correct.
And that's the information. And so this is a process that you're undergoing right now
Correct.
and going through it.
Yes.
Going through it is correct.
Exactly.
Got it. Very interesting. And so how big is your team? How many folks are working
There
on
are
this?
13 of us in the department.
Okay.
Years ago, there were many more, and I've managed teams up to 55 people. And so here, between coding and analysis and release of information, our processing, because we still bring, remember I said, we're paperless. We still bring some paper down every day from every discharge. So that is prepped, validated, made sure no tears, everything before those paper documents are scanned in. Then there's validation. And then there's an analysis team. So, but there's 13 of us. We do have some outsource services too. So the overall team is larger, but physically here in our office.
Got you. Very good. And Tiffany, with your group, how many folks are working with you?
So we share the same group.
Right.
I'm just the lower step before
Got
Scarlett.
it. Okay.
I'm kind of her bodyguard in the doorway.
Got it.
So same 13, but I've had, for release of information, I have a team of 4. I've had the same core team for over a year now. Before that, I had 2, and for a long time, it was just them 2 during all of the COVID struggles.
Oh, wow.
And so I've had them since I started at the hospital over 3 years ago.
Got
And so
it.
I have those 4 girls.
Okay, got it. Very good. And Scarlett, is there any information like for children, for teenagers, I guess? What are their rights when it comes to medical records? Is that something that's very different?
It is, and I appreciate you asking, because in the state of New Mexico, minors that are 14 and above at that point have rights. Whether it's for sexual health, whether it's for drug and alcohol, anything like that, all the way down to a pregnancy test or something, they have a right to ask their provider for that, and those rights are protected. If they use their guardian or parent's insurance, yes, it could be on there. But there are ways that they can ask for those services. Same way on the portal that we talked about. At that age, they have their own portal. They can then add to let the parents see it, but right now it's protected to them.
And that is state law. That's not a hospital law or rule that you have. That's
That is
state law that
state.
you're following.
Correct.
And so I guess for parents, it's important for them, I guess, to know that, right? That at the age of 14, their kids have this right to have their health information private.
Correct.
I'm sure many don't and share it with their parents, but they could.
They could.
And that's
Absolutely.
the situation.
Exactly.
Got it.
Sometimes parents don't understand that, and it's part of our roles in trying to explain that to them.
Right, understood. Well, very good. Well, let's go back and show again the information. If folks are listening or watching us this morning and would like access to their patient portal, this is how they can sign up then, right?
Correct.
And it then would bring in information from the clinics, I guess,
Yes.
and doctors if they're in the system. Is that how it works?
Absolutely.
Got it. And they report it to you, or it's all on the same system from the start?
It's on the same system.
Got it. Okay, very good. And again, the website is sanjuanregional.com/patient portal.
Yes.
And that's how you can self-enroll, or you can call the number on the screen. And for a radio audience, I will read it off the screen, 505-609-6121, if you would like help enrolling or adding a minor child who's under 14 years old. And then there's also a password reset number there that you can see on the screen as well. And then your new location, again, is the Kaiser Building, which is also known as 300 West Arrington Street, Suite 101. It's right across the street, Barron Avenue from the Civic Center. They're on Arrington, and that's where folks can come see you in person and request their medical records in person if they'd like to do that.
Yes.
Yes.
Got you. Or they can scan that QR code and do it automatically online.
Yes.
Got you.
Yes.
But why would they not want to come meet you two? You're great. You're
Well,
great people.
unfortunately, they're not
Come
going to
see
see
you.
us at all.
Oh, okay. I got you.
Exactly.
Understood. Well, I really appreciate you both coming in and talking about this with me this morning. It's been really educational. Thank you.
Thank
Thank
you.
you.
We appreciate it.
You're very welcome. My guest this morning from San Juan Regional Medical Center, the Health Information Management Program, here with me on KSJE.